Welcome back to the series on influencing patients, the art and science of inspiring the yes and keeping it a yes, which is very important. Today, we're going to be talking about the influencing skills that truly support the co-discovery during the exam. And we want to create meaningful relationships based on mutual trust. So remember we were talking about the language of influence. So in our last series, we talked about asking questions to determining wants versus needs, which were the open-ended questions, active listening, and getting the gift of motivators and concerns. What's next is to use it for good. Use it to influence. So the key skills that invite co-discovery are the benefit plus procedure statement, feature statements which reinforce the legitimacy, brings the logic to the benefit plus procedure statement, and what is called the tie down and test close, which are getting a baby yes before you go for the big yes. So let's start with benefit plus procedure statement. We know that features tell, but benefits sell. What do I mean by that? Many years ago, probably back in the 50s, it actually started with inspiring toddlers to do what you wanted them to do. What behavioral therapists realized is if you ask somebody to do something that might have a negative connotation, they're basically going to say no. But if you give them a benefit that ties to something they want, they're going to be more likely to say yes. Back in influencing skills for toddlers, if you had a toddler you wanted to pick up their toys, you could say, pick up your toys, pick up your toys, pick up your toys. Toddler might not move. But if you say, are you ready for ice cream? Yeah. What kind? Vanilla? Great, pick up your toys and we're going to go. They're going to be much more open to the concept of picking up their toys. Now, it's manipulation if you have no intention of getting them ice cream. It's also a great way to get your kid fat, but you get the idea of what we're doing. People, think about a good night's sleep. We've all bought a mattress at some point, and honestly, people have very little interest in purchasing a mattress. What they want is a good night's sleep. So what we're selling is the health benefits of a good night's sleep, not the mattress itself. You then justify it with logic. So people want the what's in it for me before you tell them what to do. And that's the whole concept of a benefit plus procedure statement. So here's how it works, okay? The benefit describes what's in it for the patient. And where does that benefit come from? It comes from the motivators and concerns that they had just shared with you. The procedure is the general thing that you want them to do that describes what will happen in global terms, because the features are going to get more specific. And when you do a benefit plus procedure statement, you are on the road to patient acceptance. So let's go a little bit deeper into the benefits. The benefit statement is always tied to the patient motivators. Trust me, this is a problem. My favorite story ever is many, many years ago in a galaxy far, far away. I was working with a doctor who was not the kindest and most empathetic, and he was fighting the influencing cycle every step of the way. He actually called me and he said, none of this works. I'm doing it exactly the way you want me to do it, and the patient's still saying no. And because I was feeling kind of sassy in the moment, I asked him to record a new patient experience. And I was starting to sweat it because he had a chatty Kathy in the chair. She came in, and before he asked any open-ended questions, she was like, wow, I'm glad to be here. I just came from Jenny Craig, lost 50 pounds. I'm looking good. After this appointment, I'm heading to the store to buy new clothes. I love what I see in the mirror. Now, it doesn't take a rocket science to say neon sign, appearance as a motivator, aesthetics as a motivator. Doctor didn't hear that. So fast forward to when he was actually recommending a 3-unit bridge, and I swear to Pete, this is exactly what he said. So that you can eat anything that you want, I'm recommending a bridge. And it didn't end there. He started to describe the food: steak, caramel corn. Now, if anybody had been listening to the patient, she probably would have preferred her jaw wired shut. So make very, very, very certain that when you are presenting a benefit statement that it isn't yours. I'm sure function was the doctor's benefit. It needs to be the patient. So you got to get them to hear that, right? The procedure is going to describe what the patient needs to do to achieve that perceived benefit in general terms. So, for example, let's say a patient has a time motivator so that we can get you out of pain as soon as possible and avoid any further disruption of your work schedule. Dr. Williams will see you at 11 this morning. That's a classic benefit plus procedure, right? Now, do not forget, it does need to be the patient motivators, not yours. I hope you remember the Jenny Craig story forever. So how do you set up for a benefit plus procedure statement? Again, we have lead-ins so that we can give you the smile that matches your new outlook. In order to match your smile to your new body image, because you said that appearance is important to you, any of those will do. It's once again swinging the motivator back to tie to the procedure. Then it goes to, so that we can give you the smile that matches your new positive outlook, we're going to go ahead with this very needed treatment. So let's look at a couple of these. Let's say the motivator is appearance. Because you said you wanted a beautiful smile, I'm recommending we address that missing tooth with an implant. Now, remember, it could still be an implant if their motivator is function. In order to restore full function and allow you to chew comfortably, I'm recommending an implant. So you're not lying to the patient unless, of course, the procedure doesn't deliver on that motivator. You're just moving it to what motivates the patient. Really, really important. Once you've got that benefit plus procedure statement, you can then confirm the benefit with a feature statement. And the feature statement describes the facts. This is the logic, right? The facts or characteristics of the product, service, or procedure, and the feature needs to justify the benefit. That's what it's all about. So let me give you some example feature statements on those same motivators. So, motivator appearance. The feature statement, the implant will look like a natural tooth, therefore giving you a beautiful smile. Motivator function, the feature statement's going to be the implant will feel like a strong natural tooth, therefore giving you the functionality you want. So again, it's an art form to just tie the actual logic to the benefit that you're offering. Now finally, if you're moving along and the patient is lining up to what it is that you are influencing, you're ready to start testing the waters. And these are called tie downs and test close. And what we're doing with a tie down and test close is we're asking patients to make a series of minor agreements before making the major commitment to their ideal treatment plan, the ideal solution that you're offering. So let's start with tie downs. A tie down, as opposed to our open-ended question, is actually a closed-ended question that asks the patient to verify with a yes or no response. A tie down, I used to call this like conjunction junction, because you know you're doing a tie down when it goes, wouldn't it, couldn't it, right? So an example of a tie down, after you've just given the benefit plus procedure plus feature statement, would sound something like, and having a nice smile is important to you, right? Or being able to chew anything you want would be a relief, wouldn't it? Now again, it's getting a minor positive response that will lead you right into putting your little toe into the icy waters of driving for commitment. The test close follows an affirmative response to the tie down and strengthens that patient's commitment to the next step. It's also built on giving patients a choice, because It's very important that a patient doesn't feel like a bug on their back with their mouth open. We want to give patients choice whenever we can, therefore they get a sense of control. So a multiple choice example would be, would you prefer a Tuesday or Wednesday appointment? Or an open-ended example could be, what questions do you have before I share the ideal treatment option with you? Looking for the head nod yes. Looking for tip in the scale. Because bottom line, my friends, people buy people. This is why your examination and treatment conference is so important. So how do you differentiate yourself? Right? By mastering the influencing cycle. And just as a reminder, this can be overwhelming. I think it's easy to embrace the concept of the influencing cycle, much harder to master it. So remember, what I want you doing is an influencing skill of the week. Right? Catch everybody in the act of doing it right, almost right, or not completely wrong in staff integrative practice or role play meetings, as well as starting to actually use this on a daily basis and watching the results, because what gets acknowledged does get repeated. What's next up in our series? We're going to drive the commitment, and we're going to remove the barriers to say yes. And that's going to start with a wonderful skill called consultative closing. We are going to learn to avoid the maybe as best as we possibly can, and then we're going to barrel right into handling objections. I hope that this is helping you create a more engaged relationship and partnership with your patient that drives the yes.